I am two very impressive people are on either side of mine, so I think I should let them do most of the talking. So let me first, now it's ladies first. So Prabha is a pioneer in dental healthcare on a mass level. Why is there so little awareness about dental hygiene? Because I read that about 80% of children in India have tooth decay. So what do you do about it? What are you doing about it?
First of all, namaskara, vanakkam, Chennai eppadi irukka. Little bit of my efforts to learn Tamil being in Chennai. Thank you for having me for this wonderful event. It's been very informative sessions, the few sessions which I could watch. Now, being a dentist, I think dental caries is a very prevalent issue. There are many treatments which can be done right from school age. Especially, we can routinely examine the children and children who have deep pits and fissures, especially the occlusal surface, the top surface of the molars, what we see. So the pits and fissures can be sealed early on, which will arrest the progress of disease. And there are something called fluoride varnishes also. That is also a preventive treatment. And instilling healthy habits in students, especially something basic like toothbrushing. How do you brush your teeth? I think how many of us in this hall actually know the right way to brush your teeth? And something very basic, like when you brush your teeth, when you're any of the toothpaste companies, when they show, the entire bristle head is covered in toothpaste. But the actual recommendation is a peanut size of toothpaste is used. So something as basic as this should be taught to the children, and that healthy habits, behavioral change is very important. And also something like we even advise the students to eat sweets or chocolates along with their meals, because the saliva flow is good enough.
Are the parents here listening to her advice? Hope you
So
are.
these are all very basic issues, and we are addressing these issues at the school level as well.
Ajay, what do I call you? Doctor?
Me?
Yeah.
The question was.
No, I said, what do I call you? Anyway, okay, Indu, see, according to stats I got, apparently there is only one dentist for 2 lakh Indians. Now, what I want to ask you is that the whole thing is not to criticize, but to incentivize, right? So, since you have been in government, I would wonder, why is there no awareness about, or awareness being spread about the dental problems of this country?
I think, what you say, anything about India could be correct or incorrect in some parts of the country. So, there's a saying that India lives in many countries, and that actually is not a slogan or that's not a poetry, it's a reality. So, if you go to Kerala, probably what you say may not be correct. There is a lot of awareness. And if you look at the health indicators in Kerala, especially say infant mortality, maternal mortality, they are comparable to high income countries. And so is the knowledge about health and awareness about health. But if you go to some of the northern states, large states, probably you'll find that infant mortality actually is closer to what we see in sub-Saharan Africa. So I think the inequities in health or inequities in health awareness are prevalent across the country, across states, but within states also, between urban areas and rural areas, between different income class, different caste and different classes, you will find there is a difference. So what we can say is that there are good practice examples available within the system, within the country, and we don't have to go outside to see how to improve health awareness. Actually, we can learn it from within the country where things have worked. So I wouldn't say that, the awareness doesn't exist. It exists in some parts of the country. In some parts, it doesn't exist, and there are reasons for that. And I think we can very clearly and effectively address that.
Sorry, I don't mean to start this up with a tooth for a tooth kind of situation, but the current question about dentistry.
One more thing I would just like to add, there's no dedicated dental health policy. In the National Health Mission, you have the National Health Policy, but you do not have a dedicated dental health policy which is integrated, and the availability of dentists at the grassroots, that is the primary and secondary, tertiary hospitals, they are available, but specialists are not available. We just have a BDS degree holder in the primary setup. We have n number of PHCs, but the number of dentists are very minimal and specialists are not there. So that is also one reason wherein the policy framework is not integrated with the health framework.
Yeah, and also, since you deeply focused on this, what could incentivize people to visit? See, the government spends money on health care. It spends 1 lakh some crore this year. Why are people not driven to government hospitals for dental care? Is it lack of doctors, lack of credibility, or people's belief? What is the reason? What can you do to get that happen?
So maybe what I feel is they don't take it as an emergency condition. Something like emergency, the communicable diseases, non-communicable diseases are addressed. But something as important as dental health is neglected. And in Karnataka, we have a scheme called Danta Bhagya Yojana, wherein for seniors who have lost their teeth, we give free dentures. So this improves their overall health. So I think the government should take it seriously and integrate dental health policy along with your national health policy.
So, Mr. Ravi Shankar, I think for dental health, probably the solution has to come from children. And I think it has to be part of the school curriculum, and we need to educate children, and through children, probably educate the parents. Because wherever we have seen that dental health has worked, it is through the school system. And before coming to Ayushman Bharat, I was based in the Philippines, and I've worked in other parts of Asia and Pacific. So what I'd seen was that if you educate, if you bring the elements of dental health, oral health in the school curriculum, and that we focus on young children, that is the way to improve oral health overall.
Yeah, the biggest health problem is in rural India. Completely, there's nothing, you can't deny it. Could be because there's not enough money there as far as the common people are concerned, or maybe there's accessibility roads and lots of issues. So it's like 45,000 beds in vis-a-vis 9,000 beds. That's an 80% shortage of doctors as well in rural India. I noticed recently that what we were discussing, that the CGH has this policies, sending retired doctors for limited amount of time. So why is it not possible as a policy suggestion to kind of send experienced retired government doctors, senior guys, surgeons, senior dentists, all of them to work in rural India? See, the moment you make something mandatory, they wouldn't want to do it. Like, for example, like now, doctors who are supposed to kind of, work for a particular, they go on leave, they spend 2 days there. So why not create a great incentive for these people to go and identify maybe people who are mission? Can you just, for the sake of this audience, think of a policy which could be?
If you look at the number of doctors, the number of health professionals that we have in the country as a whole, there is not that much of a bigger problem. But the problem is the concentration, as you had said, that most of our medical professionals, especially at the tertiary level, are in big cities. and they are not in the, and there are reasons for that. Big cities are where big hospitals are. Big cities are where there's a demand. Big cities are where the social facilities are, because these are also social people. They want to be in places where they can send their children to good schools. So, and that's why they prefer that. Now, ensuring that we have access to such specialized skills in rural areas, disadvantaged areas, tribal areas, I think we'll have to have a few policies, but also technology can help. Most recently, of course, we've seen that telemedicine, e-Sanjeevani, which has actually tried to democratize this kind of services, has worked very well. So working in a hub and spoke model where specialized services could still be based in large cities, and they could provide those services through telemedicine, but also we could have spoke, and we should have some smaller hubs in the outlying areas where they can do follow-up, could work. So that's one approach where we can still use the limited number of specialized services, use technology to expand their reach. But again, also, as you mentioned that, we can also expand the whole pie by extending the life of doctors, and also educating and training doctors which are at the periphery, and providing them training so that they can take on more load, and what we call task shifting. We can probably ask the doctors which are at PHCs and district hospitals to provide those kind of services under the supervision of specialized doctors.
Well, that's an answer. 22 AIMs have been cleared, but so far only 6 are functional. You had a challenging job. This must have been one as at least in an advisory or an executive capacity. So what is holding this up? I mean, that's a huge number of aims which have been cleared, like 22, of which only 6 are fully functional as far as I know, unless you can correct me. So what is holding it up? Why is this kind of why not that kind of coming? Is it lack of staff, lack of...
I didn't understand the question.
I said there are 22 AIIMS which have been, so out of which only 6 are fully functional.
Yeah. Establishing an AIMS is a very complex operation, because it's not only the building. The building is easy, but then making sure that we have the specialist at that level, and we have the training facilities and all the supportive infrastructure, and that takes time. And I think the kind of progress the government has made in terms of establishing AIMS is really remarkable. And for the longest time, out of 70 years, probably 50 years, we just had one AIMS. Now, in last 10, 15 years, we have 6 AIMS, and others, I'm sure, in 4, 5 years will also be operational, because attracting good people, training good people, and actually recruiting teachers and at that level will always be a challenge, because it takes 4 to 5 years before you can have those people trained who can train these very highly specialized people. So I think you are looking at glass half full, half empty, and I'm looking at glass half full.
In this case, I think 3/4 empty and 1/4 full. But let's switch back to Prabha. You have an NGO for, what does the NGO do?
See, I'm a life trustee in an NGO which we've been running in my constituency, Davangere. It is named after my father-in-law, Dr. Shamnu Shivshankarappa Care Trust, wherein we have 2 medical dental institutions, engineering colleges, law institutions. See, the reason I'm sharing is not to just speak about the SS Care Trust, which we are running to deliver healthcare services to the needy in around Davangere. This is how we are filling the gaps of rural healthcare services. And also through programs. We have around 15 flagship programs. We serve the people of Davangere, conducting around 600 free dialysis cycles every month. So till now, we have conducted around
Is that
30,000
for-
free dialysis.
Is there for access for people?
The BPL card holders, the people in Davangere constituency. Then programs like Pratigna, wherein voluntary blood donation is encouraged among the youth. We do have an SS Care Trust student wing, wherein youngsters who are studying in our institutions, they volunteer, become members of the student wing, and they voluntarily participate in the health camps which we conduct around, we have conducted around 30 free health camps in and around Davangere. And we visit every PHC, Anganwadis, and all the ASHA workers, Anganwadi workers are screened and educated about breast and cervical cancer awareness. And something basic as Jiva Rakshaka, wherein BLS workshop, first aid training is given to youngsters, to all the stakeholders in the grassroots. So this is how we are empowering them to adjust to the emergency situations in there at the community level. So overall, this trust is empowering the frontline workers. Even our police personals are trained in BLS and CPR.
Well, I mean, I want to ask you about, since both of you are very eminent health, I would say professionals in your own fields, the concept of alternate medicine is really picked up in India, especially the last kind of 10 years with government policy giving more stress on alternative medicines. Now, why, there's a kind of trust deficit when it comes to going to a VAD, which is supposed to be old-fashioned or rural or, etc. So why is this so?
So that alternative medicine, of course, we have a long tradition and there is a deep science behind alternative medicine. But there are two problems. One is the problem of research and the science, which has not been fully established, in the sense that unlike modern medicine, we've not done these RCTs, randomized controlled trials, to see what works, what does not work, and in what context. So that kind of documentation is not there. So because of that, what happens is that while they are very established methods of supporting many health conditions, but there are many other spurious treatments also which survive together with the very effective one. So it's very difficult to identify which is the effective treatment, which is not effective treatment, and that science behind that is lacking. We should learn from China, where Chinese system of medicine, they've done very rigorous research in many of the interventions they do, and establish that what works, what does not work. So that's one. Second is in terms of providers. The quality of providers in alternative medicine varies a lot. You have some doctors without any background providing alternative medicine. You have very highly specialized doctors who are doing this, and there is no way to standardize them. And for a person on the street, it's very difficult to identify which is a really qualified doctor, which is not. So that's a second issue. Third issue is in terms of medicines, because these medicines are also not standardized, and in terms of which medicines are really effective, which are not effective, or which are spurious, that is also a big problem. So here, I think in terms of ensuring that all our alternative medicine, Ayurveda, is grounded in research, and we have documented proof in terms of what works, what does not work, is needed. And we also have very strong regulations for ensuring that only qualified professionals are providing these services, and are the medicines which are available are also of high quality.
So what is in your preferred field, how does the credibility of alternate medicine work in the field of dental work?
See, traditional medicines, we still have neem stick, which many of the tribal area or the remote areas, they still use for brushing teeth,
Forget
which
Vikram.
has shown medicinal benefits.
Vikram Vajradanti toothpaste you bought.
Sorry?
There's some Vikram Vajradanti toothpaste, right?
Yeah,
Any input
and we
there?
also have many, even the WHO has recognized Ayurvedic toothpaste as well. So there are benefits only if it is being recognized and if it is FPO certified, or even the drug institutes also give them the license, then it is good enough.
No, that's something we were discussing about certification that earlier, that how in the golden age of Islam, the Arab physicians were far ahead of the Western physicians, and far ahead, both in terms of surgery, all kinds of things, medication, diagnosis, everything. And a lot of the European doctors studied with them, but because in Islam there was no certification, the European doctors could actually start practicing while these guys languish, and as a result, the entire stream of medicine is dead. You know, if there is no intervention in terms of certification as a credible certification, because when you when you're in an Ayurvedic hospital, you don't say doctor by and large, you say Vaid. I think even the certification is Vaid, which for good or bad has less impact than the word doctor. So how can this be sorted out? Because the government is putting a lot of money into indigenous medicine, put a lot of pressure, importance to that. You yourself have spreaded the Ayush. How can the credibility, I wouldn't say credibility, how can more credibility be added or, equalized in a country where indigenous medicine is a huge part of rural life?
You know, as you may have seen that recently the government has created 3 All India Institute of Ayurvedic Medicine, and which will not only ensure that the high quality training is done, but also high quality research on what works, what does not work will also be done. So I don't agree that, calling someone a Vaidya actually diminishes the stature of that person as compared to doctor. Our Secretary of Ayush is Vaidya Kotecha, who's one of the best known Vaidyas in the country. Actually, the importance of the name comes from what you get out of the person. I would probably trust a person with the name Vaidya much more than being called doctor if the person is providing good Ayurvedic services. So I think challenge for the government is to ensure that the training which is being given is science-based, and the medicines which are being provided in the market are of high quality.
Thank you. India, I'm finding this a very interesting trend. It's not new necessarily, but it's picking up that allopathic doctors are using various streams of healing. Like some of them are using meditation, along with medication prescription, they're using yoga, they're using music, they're using meditation. How effective would it be in your field?
In the dental field?
Sorry?
Can you please repeat?
Oh, sorry, I was speaking too fast. I was cautioned against speaking too fast. I said that in modern medicine today, a lot of doctors are combining therapies like yoga, music, meditation, along with prescriptions, some even herbal. How does that work in your field?
I think in every field it works really well, because we have seen mental health. Health encompasses physical, mental, emotional well-being. So we need to have an integrated approach. Even hospitals we have seen, which are more in the informal setting. I think many of us are aware of a pediatrician vaccinating a child through play, through music. When the child is distracted and given vaccination, he accepts it better. Otherwise, the traditional approach would be like a nurse holding the child, keeping it firm, and then vaccinating. But now, that is how, as doctors, we should not just stick to our academic learning, but also our experience and the human touch, which we can bring in our treatment also. That matters, I think. And with AI, telemedicine, you have this disconnect, the fear of disconnecting with your patients. We are encouraging telemedicine to see that the patients in the rural area can be connected to the super specialist. But then how do we close this gap? But we as a person are very much familiar with our doctors checking our pulse and giving us that assurance that everything is well. I think that it has a placebo effect. So I think using all these added forms will again help in better health delivery and better acceptance from the patient's end as well.
Well, I can see that the conclave copy is already standing there. And now this is a topic which we could have gone on forever and ever because whole day, maybe even months. So thank you both of you for enlightening discussion and thank you very much.